Good afternoon, everyone. I'm Andy Trotter. I'm the chair of Oxleas, and welcome to our annual members meeting. This year, like so many other events, we're having to do it differently, but we hope you'll find this meeting a helpful overview of the Trust's work over the past year and our plans for the future. Thank you to all of you who've joined us this afternoon and to those of you who've sent in questions. Alongside films and presentations, we'll have a live panel discussion to discuss the issues you've raised. If you've joined us through the Teams link, you'll be able to raise questions through today's event. We'll try to answer these live, but we'll also publish a question and answer session on our website following today's meeting. Firstly, we're going to hear from our Chief Executive, Matthew Traynor, on the year 2019 to 2020 for Oxleas.
As Chief Executive of Oxleas, I've been extremely proud how colleagues across the organisation have met the challenges of these past few months, and I've been particularly pleased that we've continued to take forward important pieces of work despite the pressures of COVID. I'm delighted to give you an overview of developments across the Trust over the past year. As many of you know, at Oxleas we have around 4,000 members of staff working in a wide variety of settings, in hospitals, clinics, schools, prisons and of course in people's own homes. We offer an extremely wide range of health and social care services to people living in South East London, parts of Kent and now Wandsworth Prison, and this includes community healthcare such as district nursing, physiotherapy, speech and language therapy, care for people with learning disabilities and mental health care such as psychiatry and talking therapies. Our multidisciplinary teams look after people of all ages, and we work in partnership with other parts of the NHS, with local councils and the voluntary sector. And what brings us together is our shared aim to improve the lives of local people. Continually improving the quality of our services has been a major focus across the Trust, driven forward by our Quality Improvement Programme. This has been going from strength to strength, with nearly 100 projects across all our services either underway or completed. These projects have also attracted several national awards. Our quality performance is outlined in our annual report, and we'll be publishing a full quality report next month. We're rated by the Care Quality Commission as good, and their inspection team visits our services regularly. Where they find improvements are required, we've always tried to respond rapidly. Over the past year, our partnership working has been strengthened. The South London partnership with mental health providers in South London has developed further, taking on specialist commissioning through the provider collaboratives, as well as providing services. Partnerships within the South East London integrated care system have also advanced, working with local partners to improve support for thousands of people with long-term and complex care needs. We recognise that good quality care can only be provided if we have a workforce that is well supported. Therefore, we've continued during the last year to have a strong focus on working with colleagues to understand how life at work can be improved. As part of this, we launched the Our Next Step programme in November last year. This in-depth engagement programme involved hundreds of staff members, people who use our services and local residents, and it's given us a wealth of information to guide our future strategy. We've also developed staff assemblies in each of our directorates to improve staff wellbeing. It's important to celebrate the diversity of our workforce, and events such as Pride and Black History Month are an important part of our annual calendar. It's also important to celebrate the dedication and commitment shown by our colleagues, and our annual recognition awards are a great way of highlighting this. However, COVID-19 has dominated and overshadowed our year, as it has everyone's. Our staff have responded impressively and have continued to provide care with compassion and commitment despite the pressures. Many staff moved to working remotely overnight thanks to the expertise and infrastructure provided by our IT team. Providing care via video call has now become commonplace, and feedback from our patients is positive. However, for many of our colleagues, the option of working from home is not available, and we thank those who've continued to put the needs of their patients before their own needs. COVID-19 has particularly affected people from a Black, Asian or minority ethnic background, and we're working hard to protect all of our staff. The Black Lives Matter campaign earlier this year raised many equality issues internationally, and it's led to extensive discussions with colleagues here at Oxleas, and this has resulted in the Building a Fairer Oxleas programme. The initial focus of this will be to improve recruitment and career progression for all, and to increase cultural awareness and understanding. It will take time to overcome long-standing and entrenched inequalities, but we are committed as a board to dedicate the time and resources to make a lasting difference. I would like to give my thanks to all my colleagues working at Oxleas for their professionalism, their expertise and their kindness. This year has been a difficult one for us all, and particularly for those directly affected by COVID-19. We would now like to take a minute's silence to remember those who've lost their lives due to this pandemic. Thank you. Let us all hope for a positive end to 2020. We now turn to the presentation of our financial accounts and our auditor's report.
Hello, my name's Azra Mukhtar. I'm the Interim Director of Finance here at Oxleas. I'm just going to now take you through the key headlines of the annual accounts for 2019-20. Firstly, in terms of finance and use of resources, the Trust scored a 1. That is the highest scoring that you can have out of the scores of 3 that any given trust could achieve. The income and expenditure position for 2019-20 was that we met our control total of £0.2 million deficit, and due to the fact that we met that control total, we were allocated £3 million worth of national monies in terms of reward for meeting the control total. We also sold an asset, Rowan House, during the course of 2019-20 and generated a sale on disposal of £500,000, and that is how we achieved the control total that you see listed here of £3.5 million. We had invested heavily within the estate during the course of 2019-20, principally at Queen Mary's Hospital, and there was a set of impairments that came through coming out of that investment. Effectively, impairments are where you've invested in an asset and then it is valued by a qualified valuer, and that valuer will then say what the replacement cost of that asset would be going forward. Those are the two figures that you see of the 5.7 million and the 6.6 million. We also have those same individuals do a desktop exercise most years, and they revalued all of the trust assets and increased that valuation by 7.4 million. And that gives us the bottom line that is in our set of annual accounts of a £1.4 million deficit. NHS EI effectively mark us on the control total figure, which was a surplus for that year. Giving then some additional information in regards to whereabouts we received our income. 57% of our income came from our 3 host CCGs, being Greenwich, Bromley and Bexley. NHS England then provided 23% of our income, and that includes the income for our prison services and any specialised services that the Trust provides. We then received 8% from local authorities for a whole host of children's services and other services. And then we had 13% of our income from other NHS and provider organisations where we provided services, principally non-clinical services, to other organisations. In terms of expenditure, as in previous years, we spent the majority of our money on pay. Staff costs accounted for 70% of our total expenditure. Healthcare contracts was a further 6%, and this included elements along the lines of where we need to buy in private beds or where we would have scans that we needed from other organisations. There were then smaller elements in regards to premises, supplies, training and drugs, and then a whole host of other much smaller expenditure items which accounted for the final 10%. In terms of our balance sheet or our statement of financial position, land and buildings increased in line with the investments that I will take you through in the following pages. Current assets, debtors and cash also increased during the course of the year, as did our liabilities. The increase in liabilities was due to year-end accruals, and that was then effectively offset by the increase in cash to bring our final value to £168.6 million. In terms of capital investment, there were 4 key areas that we invested in. Firstly, Queen Mary's Sidcup at £7.9 million, IT infrastructure and business performance, which would have included hardware, software and informatics, being £3.3 million. This is an ongoing area of investment for the Trust as we become more digital, both in recording of our activity and in provision of our activity. We spent £700,000 on health and safety, principally around our estates function, and then other projects around estates, including project managers, etc., to make sure that all of that £15.1 million spend was spent in the best value for money way. Moving on then to our charitable funds. These are normally recorded differently and are submitted with a separate set of annual accounts. Key headlines. We started the year at £564,000 balance. In year, we received £43,000 worth of donations and income, and we spent £144,000 on a variety of different projects. This effectively brought our balance at the end of the year to £463,000. It is an ongoing principle of Oxleas that we try to spend the money that we have donated to ensure that both our staff and our service users make the best use of those charitable funds. Finally, moving on to the risks that we saw both in 2019-20 and will be seeing ongoing in future years, there are three main risks that we addressed financially. Firstly, the ability to meet our savings plans recurrently, i.e. to make year-on-year savings rather than non-recurrently. This issue is an issue that faces not just this trust, but the whole of the NHS as we are moving forward. Secondly, achieving 100% of our income. This risk was largely mitigated in 2019-20 due to a year-end agreement. Going forwards, the Trust will be seeing far more block contracts where we will have a fixed level of income, and therefore this risk will be mitigated, but we'll still have certain aspects of performance-related delivery which could involve a risk. And finally, probably our greatest risk as a trust is the ability to recruit and retain staff. The financial element of this is linked to the fact that when we bring in temporary staffing, they are far more expensive than our permanent members of staff. There are also quality impacts in the fact that our temporary members of staff don't understand the Oxleas systems and ways of working, as well as our permanent staff. And lastly, there is an issue around actually being able to obtain those temporary members of staff, meaning retaining our current staff and then recruiting them on an ongoing basis is one of our most important risks to try and mitigate. That brings me to the end of the finance section of the annual members meeting. Thank you.
This next item is about the Board of Directors developments, the Governor elections and other changes. During the last year, we said goodbye to Shay Clement, who'd been with us for many, many years, and we welcomed Suzanne Shale and Dr. Amlan Basu to the board as non-exec directors. Now to the changes to the executive. Helen Smith retired as Deputy Chief Executive after a very distinguished career with Oxleas, and Ian Diamond was appointed as Chief Operating Officer. Dr. Michael Whitney joined the board as Director of Therapies, and Mira Nair, our Director of Workforce and Quality, left in September 2019. Rachel Claire Evans joined us as Director for Strategy and People. Jazz Thind, Director of Finance, went on secondment to Imperial College, and Azra Mukhtaj was appointed Acting Director of Finance from the 6th of January 2020. Now we move on to the summer governor elections, and we've had Michael Earnshaw, Leslie Clark, John Crowley, Raymond Warburton, Ravimba Mutiambizi, Janice Algar, Margaret Adeji and Stacey Washington, all elected as governors to the Oxleas Trust. Our newly appointed governors, who were Eddie Lynch from Bromley Mencap, Miranda Williams from the London Borough of Greenwich. Following an agreed change to the Constitution, an appointed governor to represent South East London Clinical Commissioning Group will join the council. Thanks to our elected governors who are stepping down today or have stepped down during the year, we say goodbye to Fraser Rendell, Anoop Sekhorn, Janet Kane, Victoria Smith, Sue Reed, Christine Kirkpopo and Catherine Copley, and we thank you very much for your service to Oxleas. In addition to saying goodbye to NEDs and exec and governors, we say goodbye to three colleagues. We say goodbye to Dr. Michael Whitney, who's retiring off to live in Spain, and we wish you a very happy retirement, Michael. Keith Soper, who's taking on a very challenging role as the Deputy Chief Operating Officer at Medway, and also say goodbye to Helen Day Barnes, who's our Associate Director for Children's Services, who's going to retire after a remarkable 40 years service. Thank you so much for everything that all three of you have done for Oxleas and for the NHS.
Good afternoon. My name's Richard Diamond. I'm the lead governor at Oxleas. It's great to be here at the annual members meeting today. Let me just say a little bit about who the governors are. There are 37 of us. We represent patients, carers and members of the community across Bexley, Bromley and Greenwich. And we're here really to have an influence over the policies of the Trust and let the board and the senior management know what the community feel. We also have an important role in that we appoint and we monitor the performance of the chairman and the non-executive members, and also have a fair bit of interaction when major decisions need to be made about what's happening in the Trust. But I'm here today to talk about what the Council of Governors have been doing over the last year and the membership of the Trust. As you can see from this slide, Oxleas has around about 10,000 members. Our membership strategy is trying to increase awareness of the membership about what Oxleas is doing, to ensure that the staff and the services within Oxleas know about the membership and the role that they can play in helping deliver a high quality service. We want in particular to have more younger members of the Trust. We want to see more service users, patients and carers involved in the membership. But most of all, we want to involve you as members of the Trust, engage more with you and find out exactly what you want the Trust to be doing to help your lives improve and for you to maintain good health. We run a number of events during the course of the year and publish various booklets and the like to let people know what's going on. Obviously, the last year has been more difficult, particularly since the lockdown started back in March. And so we have moved much more towards doing things on a virtual basis, but hoping that we make sure that you as the members of the Trust know what's going on and have a full opportunity to be kept informed of those activities. From a formal point of view, the Council of Governors, my colleagues and I, were involved at the end of last year, start of this year, in the Trust work on its next step strategy to ensure that it really is delivering the services and support that those who need to use Oxleas to ensure that they remain in good health want to see delivered. Because of COVID-19, much of our activity, as I've already said, has had to be virtual over the last year. Our Council of Governors meetings, for instance, now take place from our own homes, but we come together using the internet to ensure that we can talk to each other, we can engage with the members of the board, we can question the senior executives about what's going on. And we've been able to supplement that with a number of specialist meetings taking place, particularly with some of the service directors and with the specialists that operate within Oxleas, as well as meeting informally through a series of virtual coffee mornings and afternoon teas. And we're going to continue to develop those ideas as we go ahead to make sure that the governors keep together and that we really engage properly with you as the members of the Trust. Thank you.
Right, now we move on to our panel, and we're going to be joined now by Chief Executive Matthew Traynor, Medical Director Dr. Ifia Kocher, Director of Finance Azra Mukhtar, Director of Nursing Jane Wells, Director of Therapies Michael Whitney, Chief Operating Officer Ian Diamond, and Director of Strategy and People Rachel Evans. Over to you, Matthew.
Thanks, Andy. And now what we're going to do is spend around 20 minutes answering questions that we've had from governors and members, including anything that's come up live that we've been able to work into our schedule today. For our first question, I'm going to go to Ian Diamond, our Chief Operating Officer, for this one. But Ian, our governors have raised with us that members are concerned about what NHS services are available during the pandemic, during the COVID-19 pandemic. And Ian, how is the NHS coping locally?
Thank you, Matthew. So the NHS locally is coping well, I think. Certainly for Oxleas, we continue to operate the majority of our services, and we are monitoring the situation very closely in conjunction with the other organisations that we work with. But I would encourage all members of the public to seek help from the NHS when they need to, and to be reassured that we, as I say, we're open for business.
Thanks, Ian. So it's very much a case that, people who require NHS services, they might find some differences to the way they're delivered, but they shouldn't hold back on asking for help when they need it.
Absolutely.
Okay, thank you. And we've been joined by Richard Diamond now, our lead governor. Richard, how have the governors been involved with Oxleas during the COVID pandemic?
In different ways. We had to learn, as everybody else did, from a very early place, that virtual meetings had to be the way forward. We've succeeded in holding our full plans of Council of Governors meetings. Initially, I think, if my memory serves right, using Zoom, and more recently using Microsoft Teams. In addition to that, as the board and the committees of the board have moved on to virtual meetings, we've continued to have governor observers at those meetings, again using Teams. We've had quite a few meetings with service directors and particular parts of Oxleas we've been able to join in. And as I mentioned just now in my comments, we've started having some sort of informal coffee mornings for the governors, at which we put individual members of the executive team maybe on the spot. We had a very good meeting with Ian Diamond a few weeks ago, and Ifya Kocher has kindly volunteered to join us for our next meeting, which I think is one day next week, and talk to us about what's going on in his directorate. So we've kept very engaged and making sure we continue to look after the interests of everybody who needs to use Oxleas across South East London and the slightly wider community.
Thank you, Richard. And one of the things, of course, that will allow us to get back to real coffee mornings is the positive news that's coming through about the vaccine, and there's a couple of runners and riders in that field now. I'll go to Jane Wells now, our Director of Nursing. Jane, what role can Oxleas play in ensuring that as many eligible people as possible in South East London, including our service users, carers and staff, take up the COVID-19 vaccine as and when it becomes available?
Thank you, Matthew. We'll be fully supporting the national campaign. We're part of the South East London Programme Delivery Board, which is currently looking at the workforce to deliver IT, estates and distribution, etc. So very much engaged in local planning and delivery. We'll be encouraging and facilitating people to have its uptake. In the meantime, though, the flu vaccine is available, so we'll be strongly encouraging people who are eligible to have a flu vaccine to take that in the meantime.
I think that's always worth reflecting on it. We've got a good, well-tolerated vaccine that can prevent harmful infectious disease, and we'd encourage everyone to take the flu vaccine while we've got these positive COVID vaccines coming down the pipeline. So my next question, I'm going to go to Ifya Kocher, Dr. Ifya Kocher, our Medical Director. Ifya, we've got a question from a member, Marcia, about what psychiatrists at Oxleas understand about recovery in terms of how we care for service users with mental health issues.
Thank you, Matthew. So I think it's fair to say that certainly over the last 5 to 10 years, the manner of recovery has shifted from psychiatrists thinking previously that they had to treat every symptom until the person was rid of any of the symptoms of the underlying illness. But currently, we see recovery as working with the service user and agreeing what it is that's important to them and how they can begin to fit back into society and enjoy themselves and socialize with family and friends. And so what we then do as psychiatrists is to enable them to do that. So it's not just about symptoms, it's about an individual's ability to really participate in the things that they want to do, both in their own individual lives and also with the wider society. And that, to me, is recovery, and that's the way that psychiatrists view recovery today.
Thanks, Iffy. And the same members asked us about the use of medication, but also about how we use a range of other more holistic approaches, including therapies. I'd be interested in your thoughts on that, Iffy, and then I'll bring in Michael as well to talk about it from the therapeutic perspective.
Absolutely. So if you follow on from the point I just made about recovery no longer being about symptoms and medication, but more about how can we support an individual to really live the best that they can, both in their individual life and in society, you will then understand that we may need to support that individual with a range of skills, and that's not one that's just about psychiatry. So we have psychologists who would help, we have social workers, we have housing officers who may help if there are housing issues, we have occupational therapists who may help if there are skills that they need to learn to enable them to live a more fruitful life. And I'm sure that Michael can say a little bit more from his perspective on that.
Thanks, Iffy.
Yeah.
Go on over to you, Michael.
Yes, thank you. In addition to that, I think we would also want our providers to be thinking about the physical aspects of people's healthcare. So if, for example, a patient is seeing a psychologist, we should be considering all of their physical health needs as well. So, for example, if they've got issues around diabetes, we could perhaps talk with them as a psychologist about their diet, for example. Now, it's not that I have the expertise as a psychologist to talk in detail about that, but I can have at least an elementary conversation with the service user about those kinds of issues, and then perhaps connect them with a colleague who knows more about that. And we have a range of professions within Oxleas who can address all of these issues. So we expect people to think about that and think about the wider network as well. So involve family and other people in the support network when we're working with patients.
And of course, we are looking after people's physical health as well as their mental health. And a large number of the teams at the Trust are working in physical healthcare. I was really struck talking to our diabetes nurses in Bexley recently, how many of the people they see that have a physical healthcare need that also crosses over with some of that mental health requirement as well. And as a trust, I get that sense that we're always developing in terms of our understanding how physical and mental health care come together. I don't know, Jane, if there was anything you wanted to add from the nursing perspective and how we help bring all these different disciplines together around the patient.
Yes, definitely. I think physical health care forms a major part of assessment for all of our service users, including whether the primary complaint is mental health or physical health. It's a fundamental part of the care plan, and as Michael's already alluded to, working together on that care plan and how best to manage those physical health problems and to draw in all the expertise and different professionals that we have within Oxleas is fundamental to that.
Thank you. For our next question, I'm going to go to Rachel Clare Evans, our Director of Strategy and People. Rachel, we've had a question in about our leadership team, and looking in terms of sex and ethnicity, is the board of Oxleas representative of our workforce and the population we care for? And if not, what plans are in place for us to make progress on that?
Thanks, Matthew. It's a really good question. And I'm going to talk about gender and ethnicity separately because the position's quite different. So on gender, our Oxleas workforce is really strongly female. 78% of our staff are female. And that's a higher proportion than the gender balance in our boroughs, which, as you might expect, is basically 50-50. And when you compare that with the board, we're 47% female in the board. So a pretty healthy balance on gender on the board. Now, in relation to ethnicity, our Oxleas workforce is 43% Black, Asian or minority ethnic, what we refer to as BAME. Now, that's a tiny bit above the Greenwich population, which is 38% BAME, and higher than both the Bexley and Bromley populations, which are around the 20% mark. Now, when you compare that with the board, we are 37% BAME, which isn't far, actually, from the workforce balance. And it's worth highlighting that we're actually the second best trust in the UK for BAME representation at NHS board level. But we're not resting on our laurels. In terms of what we're doing, we've got a really big programme of work to improve the experience of a range of different groups right across Oxleas. We've got 4 really active and engaged networks, and each of them are championed by different members of the board. And we've also got a really big bit of work to improve the experience of our BAME staff and others, our work to build a fairer Oxleas. really big programme of work, and it's one that has the full backing of the board. And there's lots of detail about that published as part of our workforce equality plans.
Thanks very much, Rachel. And for our next question, I'm going to go to Azra, who's our Director of Finance. Azra, we've had a question about how healthy are our capital and revenue reserves here at Oxleas?
So I think firstly, the key element in terms of how healthy our reserves are is really resting in terms of our cash balance. So our cash balance at the end of last year was £78 million. If you were to take what the cash balance was at the end of October of this year, it's at £111 million. So a healthy increase, and we've managed to maintain that. The increase is principally driven by the funding mechanism that we have for COVID-19 funding, where we're given some funding in advance. So about 20 million of that is linked to that funding in advance that we are getting. But then the movement after that is still in an upward trajectory. In terms of capital, we've got a real change in the way that that is funded. So in the year that's just finished, in 1920, that cash balance really determined how much we were able to spend on capital. And we'd spent and had programmes for the future of circa £24 million per year. With the advent of COVID-19 and much greater working across the South East London integrated care system, nationally they have allocated out capital plans and capital control totals to all of the national ICSs and STPs, Strategic Transformation Partnerships. So we had to work within an overarching envelope for South East London of £176 million for 2020-21. We were able to maintain our overarching Oxleas plan, which was about £21 million through that period, and therefore we did quite well in that negotiating position. We will have to continue to do that because we've been told that going forward, so for 21, 22 and onwards, that is very likely to continue. So we will continue to work with our South East London partners to negotiate what we believe we need for the Oxleas position, but we will have to do that against a new capital control total.
Okay, thank you very much, Azra. Now I'll go back to Ian. We've had a member in Greenwich, Ian, asked about our working relationship with Greenwich Clinical Commissioning Group, as was, and our support for local GPs. And I suppose it'd be good to think about how we're working across all three of our boroughs in that respect.
Yeah, thank you, Matthew. So I would say that we enjoy a really positive relationship with all three of our CCGs. And I think one of the positive outcomes of responding to the pandemic has been the way that organisations are working together systemically in our response. And I think that's very positive, and that does absolutely include general practice. And there are very good structures in place whereby we can talk to each other throughout the week. And that's really important, I think, particularly in these challenging times of both the pandemic and the fact that we're heading into winter, which is a really, really busy time for the NHS. So all in all, I think it's a very, very positive relationship.
And I think it's worth reflecting this year that we've now got a partnership committee with Lewisham and Greenwich Trust, our acute partner locally. We've got the South London Partnership, and we've got a range of partnership relationships in place that reflect the development of the ICS. That's the integrated care system for South East London that Azra mentioned there. But that's us working together with our trust partners right across the patch. I've got a question here about risk management that I'll go to Iffy with. And it's something, management of risk, something we've been talking about all year. The question is about our risk management approach. Do we have a policy in place and how often it's reviewed? But Iffy, this has very much been a hot topic through the pandemic, hasn't it?
It has indeed. It has indeed. And yes, we do have a risk management approach. We have a policy, but also we have a system of continuously looking at the level of skills gap that there may be amongst our staff and thinking about how we ensure that we address that. And that may be through individual one-to-one conversations as may occur in supervision or through training for a group of staff who need those skills refreshed. And so it's something that we're constantly looking at. It's something that comes up, as you say, all the time, not just through the pandemic, but sometimes through complaints, through SIs, etc. And everyone right across the organization is cited on this.
Thanks very much, Iffy. Now I'll just check in the room here and make sure that that's us. We've addressed, I think, all the questions that have come in the chat through so far. So any further questions we get, we will of course answer them, as Andy said. Thank you very much to the members of the exec, and I'll hand back to our chairman, Andy Trotter.
Well, thank you so much, Matthew. Thank you to all of the executive, not only for this question and answer session, but for your outstanding work during the last year. It's been an extremely tough year for everybody. And I want to thank all of the exec and all of the workforce of Oxleas for everything that you've done during this very, very difficult time. Now we're going to look forward to the future, and I'm going to hand back to Matthew to look at our plans for the forthcoming year.
Hello, I wanted to spend a few minutes now talking about what the next year holds for those of us here at Oxleas. First of all, and we can't ignore it much as we might like to, it's COVID-19. We're just entering the winter, and that's always the busiest and the hardest time for NHS services as a whole. But this year, in addition to the normal demands of winter, we have the impact of COVID-19, both on people's physical and mental health. Unlike in the first wave of COVID, we haven't suspended other services. We kept many things going, but there was a lot that stopped across the NHS. But this time we've got to deal with a normal winter, plus whatever COVID brings. And of course, in January, we'll have the impact of Brexit, both on our staffing and on our supply chain. So there's lots for us to cope with this year as we move into the winter period. And throughout that, we really do need to make sure that we keep a good focus on quality and safety. And that focus on quality is going to be very important for us. We've had a couple of CQC inspections recently where the Commission has said that while the wards are well led and the staff are doing the right things to support and look after each other and their patients, there are some challenges appearing in terms of our managing the day-to-day risks around quality and safety. And some of that is because people have just got a huge workload on at the minute, emotionally, physically, and in terms of demand as well. So we're working as a trust to really understand the impact of the delivery of clinical services and how we keep core elements, fundamental elements of quality and safety at the forefront of our minds as we work our way through the year ahead. And then we also have to think about our workforce. And this year it's come home to us actually that you neglect the well-being of your workforce as a health service at your peril. We've had the events of Black Lives Matter. We've also had the huge impact that COVID's had on everyone's well-being, whether it's been themselves, their family, the colleagues that they work with, or just the general sense of anxiety and fear about the huge change we've seen socially and personally over the last 12 months. And actually, as part of that, we're doing a lot as a trust to look at how we can become the best possible place to work. That includes looking at equality and equity, looking at how we support people to develop to the best of their potential and create fair, transparent opportunities for promotion and progression within the trust. And this is very much an agenda that we need to keep pushing on even while we're dealing with the impact of COVID and the quality and safety issues over the winter, because we've heard so many fantastic and often very, very difficult to listen to stories from our staff this year about their experiences of working in the wider NHS, their experiences of being Black or Asian or minority and ethnic in English society today, and their experiences of working at Oxleas. And as we move into next year, we need to look very carefully at making sure we're a great place to work for everybody. And that includes for people who've got their own problems with their mental health and their LGBT colleagues as well, and making sure that we become a trust that recognises the great strengths we have as a diverse employer that brings everyone's best to work. We also have to have a think about the future, because the great news is there is a life beyond COVID and all the challenges that this winter will bring. And in the spring, we're looking at really kickstarting a couple of our strategy initiatives. You'll remember the Our Next Step work we did last year. And that told us a lot about the stuff that really matters to our staff and our patients. And that's given us a framework for us to make decisions about how we move forward as a trust. We'll be looking at two particularly big and exciting initiatives. One is around trying to develop some great models for out-of-hospital care and make that a part of everything we do across physical and mental health. And the other is to really tackle some of the delays in our services. So it's not just that people are waiting for services, they're facing delays over and above what you can reasonably be expected to wait. And once we get through the real pressure and the real push of the next few months, we'll be looking to launch them in the spring and to take all of our partners, our stakeholders with us as we launch those two strategic priorities for the Trust. And talking to partners, we've done some great work in the last couple of years, both in the South London Partnership with SLAM in South West London and St George's, and within our boroughs, with our partners in the local authorities in Bexley, Bromley and Greenwich, with a number of great voluntary sector partners, people like Mind, Hestia, The Bridge, working with First Step Garages, Charlton Athletic, some great people that are really helping us deliver some first-class care. And those partnerships are all the more important these days. And as the integrated care system in South East London really comes to maturity, you can expect to hear a lot more about partnerships that go beyond our sort of core mental health and community services portfolio. We've recently been doing some fantastic work with Lewisham and Greenwich Trust, and I'm delighted that that partnership is really coming to fruition with the support and sponsorship of our board and executive. So this is going to be a hard few months, there's no doubt about it. Hard few months for us all operationally, clinically and personally. But there is lots to be optimistic about and looking forward to next year with hope, both around things like the way we can manage COVID, the way we're going to pull together to support our staff and look after our patients well through what's going to be a challenging winter. And then on the horizon, some really exciting developments in terms of Oxleas' strategy and our future direction of a trust. It's great to be able to talk to this annual members meeting about these priorities and about that work for 2021-22. And I very much hope we can work with you with your support and input as we take on these challenges and opportunities for the year ahead.
Well,
thank you so much for joining us at this year's annual members meeting. I hope you've learnt about what's happened during the last year and our plans for the future. And I sincerely hope we can meet in person at our next annual members meeting. Thank you very much and goodbye to you all.
Bye folks, bye.
Bye.
Goodbye everyone.
Bye.
Bye.